Approximately 1 in 4 people in the UK will experience a mental health problem each year. In England, 1 in 6 people report experiencing a common mental health problem in any given week. The South London and Maudsley Trust provides NHS care and treatment for people with mental health problems, covering a combined population of nearly 2 million people. Heather Close is a 24-bed unit away from the main hospital site. It offers rehabilitation for people with long-term mental illness.
This is from this week.
Dr. Raj Mohan is the consultant at Heather Close. Dr. Mohan helps patients plan their treatment and offers medication and social support.
We often see people with mental illness such as psychosis experiencing relapses multiple times. Many people will also have additional drug and alcohol problems, contact with the police or probation, and some people may have experienced homelessness as a result of the mental illness. In essence, this is a group of people with high levels of treatment needs, and they need a lot of support.
Deepa supports patients on the ward who have problems with mobility. She is very keen that mind and body problems are both given equal importance. Her work has led to more patients being able to go outside independently and gain confidence.
Did you do your exercise today?
Yeah,
Your leg exercise?
Monday, Wednesday, Friday.
Okay. Oh, that's great. It's easier now. It's becoming easier, you're walking?
Antonella works as a clinical psychologist. She sees patients individually to discuss their fears and help them cope better.
Is something going on in your mind?
Well, just remembering bad memories. Yeah, but I've tried to fix these many times before, but it doesn't seem to work. It just seems to go round and round, and they just don't leave me alone.
Well, perhaps we can think about something else that you can do to have some sort of relief. What is your favorite activity?
I like football.
There is the possibility to get involved there with the football team, so you can go weekly to
Okay.
join the team and play football together with others.
Any other thing that you want to talk about?
Adedapo is the team leader for Heather Close and is responsible for the overall unit. She is a nurse by background and encourages patients to come to her if they have any issues or complaints.
There are psychological interventions that provide coping strategies for people who are lonely to get them motivated and also distract from the illness and live a healthy life. The nurses also provide support with self-medication, which help patients to self-medicate when they are discharged in the community.
A bottle of vodka has recently been found in a patient's room, leading to a conversation between staff nurses Arati and Amelia.
You know that lady brought back a bottle of vodka when she went on leave?
Oh.
She did, yeah. I don't know, she's done it before. Anyway, we got it taped over. We need to talk to her about how that works with her medication, you know. You know, you can't have that with all the medication that she's taking. Yeah. So maybe she's okay now, but maybe in the next 15 minutes you can see her in the quiet room and have a chat with her. I'm sure she'll be all right with that. Yeah.
Jean is in charge of planning activities for patients. Her work centres around keeping patients active on the ward and outside.
There is a stigma attached to being mentally unwell, and I think when you get together with people in the community and just relax and do what you enjoy, that stigma somehow goes away, the things that they're doing and want to do.
Jean has booked a one-to-one with Mark, a patient who is experiencing problems with motivation. Mark was transferred from prison and has been on the ward for 2 months.
When I know that someone's coming to visit me, it gives me that push to get up in the morning. I kind of set my alarm so I know. Knowing that really that this is a safe environment and knowing that I can speak to whoever I want to be able to speak to about any issues or difficulties. So I know that if I feel stressed out, I can just go and approach a member of staff. So that gives me the motivation to wake up basically, and knowing that I can trust people here.
Pat is an experienced nurse who's worked in rehabilitation services for a long time. She has recently led the development of a new care model for people with mental illness combined with drug and alcohol problems.
As a mental health nurse, my job is not just to administer medication. We have patients that have feelings, have emotions, so they will come to us for support. I listen to them and I would give them advice, just like how I would advise a friend or a family member. Treat them with respect and also just be there for them, just be a listener, basically.
Blood sugar being really high.
A patient has recently had problems managing their diabetes. Raj and staff nurse Sonia decide to tackle the problem.
She went to A&E.
Yes,
Yeah.
ambulance, yes. I was told, yeah, they got the ambulance to take her down to A&E.
But she refused to go. She didn't go. Then we got an appointment for her to see the GP.
Okay.
So they've adjusted the medication, but they want an early morning blood sugar done.
Okay. We need to educate her regarding her diet.
Yeah.
That's very important because she doesn't seem to understand.
Why don't we give her one of the Eat Well guides? The one which has all the different foods. Have you seen that? The plate.
Oh yeah, yeah,
got
that one, yeah, yeah,
each
the
one
different
plate.
portion, yeah.
Yeah.
the portions, yeah.
So what she needs to do is to cut down the free sugars, reduce starch, and we monitor her BMs regularly.
Currently experiencing
Occupational therapist Jess and Bobby talked to staff nurse Pat about a patient who is having trouble with their mobility.
Have you had a discussion with her about what she's finding difficult?
Yes, she's saying that when she tries to get in the car to actually sit down, it's difficult for her because she enjoys going out.
It's quite low, I guess, the car, so she can have that difficulty, but it's really important that, you know, that we don't stop her going out and doing what she wants to do.
So I think it'd be very good if we assessed her with a transfer, see what the actual problem is, if it's actually her technique or if it's a physical problem which we need to address. We can talk about like what we need to put into place here to make sure that people are engaging in the things they really want to be engaging in.
I used to self-harm, to cut myself. I jumped off a building. What I'm saying is also there's great supports out there. There's the Samaritans out there that can help. There's mental health workers, professionals in A&Es, people out there that will help. You just have to open your mind and use it. I know sometimes when you're unwell that you don't really want to seek the help. You just want to bury it and just get on with your life. But sometimes you need to go and get the help before you can get yourself better. Look after yourself, look after your mental state and just rock on, really.